Tonight we're on to talk about a membrane sweep. We talk about this in week 2 of our antenatal classes. And a lot of people wonder, well, what is a membrane sweep? Quite a lot of us have them. I personally have not had one, but just to give you a wee bit more information of what to expect when you come to that stage in your pregnancy, if you do. So a membrane sweep in pregnancy, which can be known as a membrane sweep or a cervical sweep, is a procedure where a midwife inserts a finger into the cervix and should gently sweep it around to separate the amniotic sac from the cervix, potentially stimulating labour. The membrane sweeps are offered to women who are nearing or past their due date to try and naturally induce labour, potentially avoiding a more medical intervention like induction with medication. The procedure. So during a membrane sweep, a midwife or a doctor will perform a vaginal examination and use a gloved finger to gently sweep around the cervix, separating the membranes from the uterine wall. Well, how does it work? The separation of the membranes may possibly release hormones, which are prostaglandins, that can help the cervix to soften and stimulate contractions, which potentially can lead to the start of labour for some people. But while membrane sweeps can be effective in some cases, they're not a guarantee to induce labour. Their success depends on the individual's body, the readiness, if they're ready for labour, and typically they're offered after 39 weeks of pregnancy or when a woman is past her due date. Have you had a sweep? How did you find it? Was it successful? Sometimes sweeps, they only work if you're naturally going to go into labour within a 24-hour period of it happening. So many would say, well, what's the point? Many of us get to 40 weeks and think, well, I'm kind of done now. I'll try anything to get this baby out. But what we need to remember with a membrane sweep is at the end of the day, it's your choice. They're not compulsory. You don't have to have them. But if you want them, it's your choice and you should consent. Let me know how you get on. If there's any more questions about membrane sweeps, just pop your questions in the answer below.